Welcome to Trailhead Health. These days, we all know someone who's suffering from allergies. We all know someone who can't eat certain foods, or can't be around certain things, or maybe even carries an EpiPen. Why are we developing these allergies? What is causing these allergies? What other forms of allergies are there in addition to food allergies? And most importantly, is it possible to cure allergies? Is it possible to get rid of them? After all, we don't remember too many stories of our grandparents or people back in the 50s developing allergies. So, what is different today? What is causing allergies to come up today? At Trailhead Health, we are committed to helping consumers find answers to questions such as these every single day. Today, we would like to introduce you to Dr. Jay Wilson of Allergy Elimination Center of Minnesota. Dr. Wilson received his doctorate in chiropractic in the year 1964 and has been in practice ever since. He's a doctor of pastoral medicine and a health minister, and lovingly calls himself a holistic allergist. Using the principles of biokinetics, kinesiology, chiropractic, JMT, NAET, and functional medicine, Dr. Wilson has developed a very unique method to not just manage allergies, but to get rid of them. He's had tremendous success with many of his clients in the last 50 years and is very strong advocate of people not having to live with allergies. Allergies can be eliminated. His method does not involve any invasive procedures, no needles, none of that, and therefore it's especially helpful in children. In this sit-down interview, we talked to Dr. Wilson about his methodology, how he developed it, and why he's so confident that allergies can in fact be completely eliminated.
There's hardly a symptom or condition that is neither caused, aggravated, or accelerated with allergies. So the other day, a 12-year-old asked me, what are allergies and how come what you do helps them and eliminates them? Well, we develop allergies for a couple of main reasons. One is because of our SAD American diet. SAD meaning standard American diet. We don't have the 90 nutrients, the 90 vitamins, minerals, and enzymes that are necessary to make the body work optimally. Our diet today is food is grown on mineral deficient soil. It's laced with trans fats, sugars. It's just very unhealthy. And number two is we live in a very toxic world. We live in a world where our water is toxic, our food is toxic, our environment is toxic. It's been said you can't get out of your bathroom in the morning without being exposed to 167 different chemicals. So what these toxins do is they kind of clog up the system and they don't allow the body to work right. So as a result of these two things, our sad diet and our toxic world, we start to develop allergies. Now people think of allergies in terms of itchy eyes, runny noses, and hives. Believe me, that is the smallest part. Allergies can cause digestive problems and female problems and joint aches and muscle pains and behavior problems in children and cognitive problems and on and on and on. In fact, I make the statement that there's hardly a symptom or condition that is neither caused, aggravated, or accelerated with allergies. So because we don't feed it right, and because we jam it up with a bunch of toxins, then the body starts developing allergies. And allergies simply mean, in the body's language, it's like a foreign invader. The body thinks each allergen is a foreign invader, like a bacteria or virus or something like that. And so it reacts, and the reaction might be having stomach problems. The reaction might be your brain won't work right because of the different chemicals and so forth. So, how do we get well? Well, first of all, we have to realize that the body is a self-healing organism. The body has every drug, every chemical, every hormone it needs if we feed it the nutrients that it needs and if we remove the toxins. So, how do we go about doing all this? Well, first of all, we do an allergy test to see what allergies you're allergic to. Second, we do a blood profile, a very thorough one, where we test 67 different items in your blood, testing your liver, your thyroid, your autoimmune functions, and your blood count and everything. So we want to know what that diet, a sad diet and toxic world, has caused in our body chemistry. What functions have been disrupted and what are we deficient in and so forth. And then we go about doing a detox. The detox program takes about 3 weeks. It's eating a very specialized diet and taking supplements in order to pull the toxins out of the system. And then develop a plan to eliminate the allergies, which is obviously what I do, and to develop a nutritional plan based on the blood profile that we have done and where we determine what the imbalances and deficiencies are. And then lastly, we need to take a look at altering your lifestyle because you know the definition of insanity, doing the same thing over and over again expecting a different result. So we need to take a look at our lifestyle so that we can change it, improve it, and move it toward a healthy lifestyle so that we don't keep doing the same things over and over again that got us sick to begin with. So that's how we get sick, that's how we get well, and it's the only way I know of.
Dr. Wilson, is your treatment effective in children?
Absolutely, positively, yes. Many times I can change the direction that a child is going in. I can make lifetime changes for them. I can take care of tummy aches, digestive problems, behavior problems in children. One little boy that I took care of, his dad said, you know, when he gets into something he's allergic to, he becomes a till of the Hun. And after we got done treating him for his allergies, we have this sweet little boy again. In fact, his mother told me that when she realized this, that she said, I just broke down and cried because I realized that I had my sweet little boy back again. And this is so rewarding to be able to help children. That's going to make a lifetime change for them. We can help children focus better, pay attention in school better. I've had situations where the diagnosis for autism spectrum and ADHD has been dismissed by the doctor after their allergies were cleared. So allergies are super important with kids. It's so rewarding, so satisfying for a doctor to be able to change children's lives in such a way. And the thing that is so powerful, I guess, is that the idea of allergies causing all these problems, or allergies being at the root cause of the problem, is not even on the parent's radar screen. And frankly, it's not even on most doctors' radar screen. Okay? They don't realize that there's hardly a symptom or condition that isn't either caused, aggravated, or accelerated with allergies.
Dr. Wilson, when you are doing the testing or screening for allergies, what type of allergens are you screening for?
Well, we screen for the usual inhalants, the molds, pollens, trees, weeds, and so forth. And foods, we screen a lot for environmental issues, latex, formaldehyde, artificial coloring, flavoring, preservatives. We screen for autoimmune problems. We can actually become allergic to different body substances And this, I believe, is the foundation for a lot of autoimmune problems. And so let me give you an example, or not an example, but let me read an actual list of things and categories that we will be looking at. One is the inhalants, like I mentioned, the grasses, flowers, pollens, powders, smoke, cosmetics, perfumes, chemical fumes such as paint, insecticides, fertilizers, flour from grains, etc. And next would be ingestants. These are allergens that are contacted through the normal course of eating a meal or enter the system through the mouth and thus find their way into the GI or gastrointestinal tract. These include foods, condiments, drugs, beverages, chewing gums, vitamins, supplements, etc. We can have contactants. These are allergens that produce their effect by direct contact with the skin. Examples of contactants include poison ivy, poison oak, poison sumac, cats, dogs, rabbits, cosmetics, soaps, skin creams, detergents, rubbing alcohol, gloves, hair dyes, various types of plant oils, chemicals such as gasoline, dyes, acrylic nails, nail polish, fabrics, and formaldehyde. Another category is injectants. These are allergens that are injected into the skin, muscles, the joints, the blood vessels in the form of various serums, antitoxins, vaccines, drugs, and they also include substances entering through insect bites. And we have infectants. These are allergens that produce their effect by causing a sensitivity to an infectious agent such as bacteria. And of course we can have genetic causes. Most people inherit their genetic tendency from their parents or their grandparents. Allergies can also skip generations and be manifested very differently in parents than in their children. And then a large category of molds and fungi, and then like we mentioned, the autoimmune problems. So these are all different kinds of areas that we test in, and with the way that I test, we can also have a patient or parent bring in a sample of a food or carpet or some other item from their environment that I can test, use for testing, and then also for treating it. So it's a little different than most allergists.
Dr. Wilson, in your experience with your clients and patients, what are the most common culprits when it comes to allergies? And also, is the list specific when it comes to children?
Common culprits: dairy, gluten, soy, sugar, eggs are the most common ones. With children, especially with ADHD, the artificial coloring, flavoring, preservatives, huge, huge.
Dr. Wilson, how did you develop the allergy elimination method that you do? There just doesn't seem to be any doctor around that we've seen that does it exactly the way you do it. So how did you come up with it?
Well, first of all, I have developed it over a course of 40 to 50 years. And so what I've done is I have found certain aspects of different treatment methods that are effective and that work, and I've kind of put them together. Nobody, I guess, does exactly what I do, because what I do is gradually evolved through the last couple dozen years using different methods. We use, for example, NAET, some people are familiar with, stands for Nembutiped's allergy elimination technique. I use Biokinetics, which is a form of treatment for all kinds of problems, and Jaffrey Miller technique. And what I've done is I've taken what I feel is the best, most effective part of each part of these treatments and put them together. And then we have to straighten the diet around, clean the diet up, and if necessary, give supplements to balance the body chemistry, and so that we can bring about healing like it should be. We've looked at problems from different aspects. We don't just limit it to allergies, but sometimes there can be emotional components that can be a problem. Sometimes we need to talk about exercise. Sometimes we need to really talk seriously about sleep issues, because all of these can come into the picture if we want to get lasting results and effective results. And I guess, simply put, I've found many things through the years that work, and I've eliminated things that don't work.
How do you screen for allergies?
I don't do the usual medical testing with the pinpricks on the back. We use a form of applied kinesiology. And what I do is we have the patient lay on the adjusting table. When we do, we'll find that one leg's going to be longer or shorter than the other. Then I'll check a bunch of reflex patterns to see why that's happening, and then we'll make some adjustments on the spine. When we get done, the legs will balance out and they'll be even. The system will be balanced. Now the body is an electromagnetic field. So if we bring something in contact with that body that's not good for it, it's either toxic or allergic, the whole nerve and muscle system tenses right up. And then guess what happens? That leg pulls up short again. And it happens almost that fast because we're dealing with the nerve system, the electrical system of the body. If it's not a problem, it doesn't react, it just stays even. So what this does for us, it helps us to identify not only the true allergens, but also helps us to identify the hypersensitivities. In my experience, there isn't much difference between a real allergy, which develops antibodies and can be detected in a lab test, versus hypersensitivities, which can't be tested with a lab test. And they both react almost identically in the body adversely. The other thing is it enables us to have a patient bring in a sample of whatever they might be suspicious of from their environment. It might be food. We'll just have them bring in a tablespoon of food. It might be the family dog. So we'll have them bring in a hair of the dog and a saliva sample. It might be a piece of carpeting that they put in that's new in their environment. So anything that's questionable, we can have the patient bring in a sample. We can then use that for testing, and then if that turns out to be that's a problem, then we can also turn around and use it for treating.
Thank you, Dr. Wilson. As I'm listening to you talk about allergies, the one thing that is coming to my mind is maybe children should just be screened for allergies. What is your opinion on that?
Yes. First of all, most allergies are hidden because people don't know that they're allergic to different items or foods and so forth, and they're not aware of the effects that they can have on them. So if we were able to screen all children, we would be able to find problems that would be affecting their behavior, affecting their focus in school, their ability to learn, their coordination, sports, all kinds of problems. For example, I had a child with growth problems, wasn't growing. After her allergies were cleared, she grew 4 inches in just a few months. And this is something that parents wouldn't even think about. It's not on their radar screen. So if we were to do an allergy screening test for all children, it would make a huge difference in their health.
So let's say that through the screening process, we've come to identify 12 different things that we maybe are allergic or hypersensitive to. Once that determination is made, how do you go about treating each and every one of these allergies?
Well, first of all, each allergen is eliminated usually with one treatment. I know that sounds unbelievable, but that's our usual experience. Sometimes if it's a real deep-seated allergen or one that's really affecting the individual adversely, it might take 2 or 3 treatments in order to clear it. Once we've gone through the entire treatment program to whatever number that we started out with, and we'll then wait 3 months. At the end of 3 months, I'll have the patient back again. Then we'll retest everything that was positive initially, and be sure that they're holding. We might find that there might be one or two that might need an additional booster treatment.
Well, that's great. So we've determined we need to handle each treatment for each allergen individually. What does a single treatment involve? Is it in any way painful or invasive? Can it hurt? And really, how long does each treatment take?
Nothing that I do in my office is in the least bit painful. And this is why I get along great with kids, because we don't use needles, nothing hurts, and they love us for it. Okay? So how long does it take? Each treatment takes about 15 minutes. What we do is we get the patient adjusted so that their system is balanced, their legs are even, and then we put a vial in their hand, whatever we're going to be testing that day, if it's eggs or milk or whatever it is. And when we do, that leg will go short, and then I'll come up and I'll work on what I call the master reset button. It's actually the brain stem and a major acupuncture point. And I use a little instrument to do it. It's, in fact, I'll show you what it looks like this. I carry it with me all the time. It's very light, and it's just a light click. And we use that and a point up here. And when we get done, we'll go back down, we'll find that the legs will be even. So once the legs are even, we'll take the vial out of their hand, out of their energy field for a short time, just 7 to 10 seconds. Then we'll put it back in their hand. And we'll find that maybe the first time that leg went up a half an inch short. This time it's only about a quarter of an inch short, so it's reacting less. So then we'll come up and we'll work on the master reset button again. We'll come back and the legs will be even again. We'll take the vial out of their hand and wait 7 to 10 seconds, put it back in, and this time maybe it'll be 1/8 of an inch. So every time we do this cycle, it reacts less and less until pretty soon it doesn't react at all. So when we've done that, then we use a laser to work on acupuncture points. We acupuncture the acupuncture points in the ear. There's a branch of acupuncture called auriculotherapy. And in auriculotherapy, the whole body is represented in the ear. And I have a chart on the wall I can show patients this. And so we laser the whole ear for a short time, and then we laser down either side of the spine, because there's a major acupuncture meridian or energy channel called the bladder meridian. Starts here on either side of the bridge of the nose, goes up over the head and down both sides of the spine, down both legs all the way to the little toe. And we work on the bladder meridian with the laser because there's all kinds of other connecting points with the other 11 meridians. So our goal here is, while the patient's holding that allergen in their hand, we want to normalize the acupuncture energy system. So we're in essence saying to the body, it's okay now, it's not a threat, it's not a foreign invader, it's okay. And so when we get done, the legs will be even, or the short leg actually might be longer, it's overcompensated, and that's actually where we want it to be. So then we're done with the treatment for the day. Oh, excuse me, missed a couple points. And we laser acupuncture points in the hand and the wrist, and in the knee, and in the foot, and then we're done. Then when the patient comes back on the next visit, we'll get them balanced again. Then we'll take the vial for the substance that we treated last visit, put it in their hand, and see if it reacts. If it does, we might have to treat it a second time. If it doesn't, then we move on to the next allergen. And that's how we do it. Simple, easy, effective, and painless.
That's great. So when you start the treatment, there's two questions that come from your explanation. One is, every treatment seems to start with chiropractic adjustment. Why is, in your opinion, that so significant and important? And the second is, you mentioned stimulating the acupuncture points using laser. Why laser? How did you opt for that?
The treatment that we do is with chiropractic care to align the spine, be sure that the nerves are working right, because nerves control every organ, action, tissue, function. cell of our whole body. So the nerves have to be working correctly. So the treatment is with, like I said, chiropractic adjustment first, and then we use laser acupuncture. We use acupuncture, but we use lasers. A lot of times people don't realize that there are many different ways you can stimulate acupuncture points. And we use lasers instead of needles because a lot of times people, especially kids, have an aversion to needles. And the other thing is it's much quicker and faster. So that if we were going to use needles, the patient would have to lay on the table for 20 minutes. And to have a hyperactive child lay on the table for 20 minutes with needles sticking in them just ain't going to happen. So we want to use the quickest way, which is lasers. And so what we're actually doing is we're saying to the body, it's okay now. This allergen that we're treating you for is not a foreign invader. It's okay, and it's not a threat to you. And so that's what we're doing with allergy elimination work. Sometimes people say to me, you know, Dr. Wilson, you just tested me for allergies and you came up with 23 allergens, and I'd really like to just take care of the top 6 ones that I know that I'm allergic to. Can we do that? And my answer to that is no. And the reason is because if we treat 6 allergens out of 23, we're still going to have 17 that are dragging the immune system down, and we're going to not have lasting results with the 6 that we did treat. You have to remember that most allergens are actually hidden. They're hidden, we don't know that we have them, and most of the time we don't realize how those allergies are affecting us, because allergies can affect us in so many different ways, whether it's digestive, whether it's joint pains or muscle aches or female problems or kids problems. So we're not aware of that. So for that reason, no, I only treat whatever we find and get rid of all of them, and then that's going to jack the immune system up where it belongs, and the body will take care of itself.
Thank you, Dr. Wilson. I do have one question for you around just expectations from you as far as your patients are concerned. What are you expecting from your patient that is coming to receive this treatment?
You know, the scripture says, my people die for lack of knowledge. And I feel that one of the reasons that we get sick today is people don't realize what's necessary, why they get sick, and what's necessary to get well again. And so I feel that patient education is absolutely primary and a very important part of my care. The word doctor actually means to teach. And so we should be teachers. And so we should be teaching people how to not only get well, but how to stay well. So this is what you can expect from me. What I expect from you is you need to realize and accept the fact that we're in a partnership. I have to do my part, and I expect you to do certain things. So when I coach you and educate you on lifestyle changes, which are extremely important, that you'll take them and run with them and incorporate them into your way of being. You remember the definition of insanity, don't you? You know, doing the same thing over and over again, expecting different result. Well, if we're going to go back to the lifestyle that set up the environment, the situation that would drag our immune system down and cause allergies, then we're not going to get lasting results. So in order to get lasting, permanent results, we need to be willing to change our lifestyle. And I feel my job is to educate you and train you in a way that is healthy, and it's your job to take the ball and run with it. So I expect a certain commitment from patients, and it's important because I can't do the whole job. Again, it's a partnership. It's both of us working together, both of us having the common goal of getting you well, getting you healthy, and get rid of your allergies. Sometimes people ask me, Can you eliminate an allergen that's caused an anaphylactic shock? And my answer to that is no, I can't. Um, I can sometimes help make it less sensitive so that if they get exposed to it accidentally, they won't go into anaphylactic shock. But it's not something I say, yeah, we're going to eliminate this allergy just like I do with some of the other allergens.
Dr. Wilson, you know so much about so much. How do you keep up with everything and how are you able to evolve your treatment method?
First of all, I love learning. I think when you quit learning, you're dead. So I love learning. I love reading. I love new things. I love especially to be on the leading edge when things develop. I love to be able to bring things to people that are new and effective. And I guess that's the main thing is we're always looking for what's effective, what's going to help people the most. And finally, I just love educating and teaching people healthy lifestyles and eliminating their allergies. It's my sport, it's my hobby, it's my vocation, it's my mission. My wife actually says that if I won the lottery, I would still continue practicing. And that summarizes, I guess, why I'm still practicing and all of my classmates are retired already.
Thank you, Dr. Wilson. So there you have it, folks. In this whole presentation, we covered how allergies can be eliminated naturally. If there's two things you can remember out of this whole entire recording, it's as follows. Number one,
There's hardly a symptom or condition that is neither caused, aggravated, or accelerated with allergies.
and the second, and perhaps the most important thing,
The body is a self-healing organism. The body has every drug, every chemical, every hormone it needs to get well and stay well, providing we feed it right and get rid of the toxins, eliminate the allergies.
thank you, Dr. Wilson. If you have any further questions for Dr. Wilson and his allergy elimination technique, please feel free to reach out to him at 612-866-7575 or look him up on www.allergyelimination.org. Thank you.